Good afternoon, Ham and Reese. Let's begin the warm-up session. Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to continuously learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Your preparation time is over. Please start your OET speaking roleplay.
Good morning, Mihiraa. I'm Hammond Rees, one of the nurses looking after you today. I understand you've been experiencing some discomfort after your recent surgery, and I'm here to talk with you about managing that pain and making sure you're as comfortable as possible during your recovery. So, Mihiraa, I wanted to check in and see how you're feeling.
Oh, hello, nurse. Yes, it's still quite sore around my stomach where they operated. It's a dull ache most of the time, but it gets sharper when I try to move.
I'm sorry to hear that you're still experiencing pain, Mihiraa. It's important for us to manage your pain effectively so you can recover comfortably. I understand that you might have some concerns about taking pain medication. Could you share with me any specific worries or questions you have about it? This will help us address your concerns and find the best way to manage your pain together.
Honestly, I'm a bit worried about taking too much pain medication. I've heard it's easy to become dependent on it, and I really don't want that to happen.
I understand your worries about pain medication, and it's perfectly normal to have those concerns. We want you to feel completely comfortable and informed about what we're doing. Let me reassure you that we take the safety of pain medication very seriously. The medication we prescribe is carefully chosen for your specific situation and is prescribed at the lowest effective dose. We'll be monitoring you closely to make sure it's working as it should and that you're not experiencing any unwanted side effects. It's also important to know that this medication is intended for short-term use, specifically to help you through this initial period of recovery. As you heal and your pain lessens, we'll gradually reduce the dosage and eventually stop it altogether. Mihiraa, let me inform you of its role in supporting recovery. By managing your pain, it will be easier for you to get out of bed, walk around, and do the things that will help you heal faster. It can reduce the stress your body is under, which is really important for recovery. When you're more comfortable, you'll be able to participate more fully in any physical therapy or rehabilitation exercises that are prescribed, which will ultimately get you back on your feet sooner.
That does make sense. I hadn't thought about it affecting my healing, but I'm still nervous. Is there anything else I can do besides medication?
Absolutely, Mihiraa. We can definitely combine medication with non-medication approaches to manage your pain. These non-medication methods can be very effective and can sometimes even reduce the amount of medication you need. For example, relaxation techniques like deep breathing exercises can help to ease muscle tension and reduce pain perception. We can also work with you on finding comfortable positions that minimize strain on your abdomen. Applying heat or cold therapy to the area can also provide relief for some individuals, and we can discuss which might be most suitable for you. We can also explore gentle massage, if appropriate. We can teach you some of these techniques, and you can use them alongside your medication. The goal is to create a comprehensive pain management plan tailored to your specific needs.
That sounds much better. I'd much rather try a combination of things. So, the pain medication you're giving me, is it safe? I mean, why can't we stick to these non-medication methods alone?
Mihiraa, I can absolutely understand your hesitation about taking pain medication, and it's really important that you feel comfortable and informed about it. It's true that some people worry about pain medication, and it's good that you're asking questions. Let me explain why it's so important in your situation right now and how we make sure it's used safely. You see, after surgery, pain isn't just about feeling uncomfortable. It can actually interfere with your body's natural healing process. When you're in pain, it's much harder to rest properly, and rest is absolutely vital for your body to repair itself. Pain can also make even gentle movements feel excruciating, yet moving around is so important after surgery. If not, complications like blood clots and pneumonia, which can be serious, can occur. Pain medication helps you rest comfortably so your body can focus on healing, and it allows you to move gently and safely, which is crucial for preventing those complications. Now, about the safety of the medication, Mihiraa, we only use medications that are approved and have been shown to be effective and safe when used correctly. The specific medication and dosage are carefully chosen by the doctors based on your individual needs and the type of surgery you had. Besides, we don't just prescribe it and leave it at that. We'll be monitoring you very closely while you're taking it. This means checking in with you regularly to see how you're feeling, making sure the medication is working as it should, and watching for any potential side effects. We're here to support you through this whole process, and we'll adjust the medication if needed.
Okay, I understand. Thank you for explaining everything so clearly. I feel much better about it now.
You're very welcome, Mihiraa. So, let's work together. Let's keep track of your pain levels, and we'll adjust the plan as needed. Please don't hesitate to let us know if you have any other questions or concerns. Now, can I have your consent to start the administration of pain medication?
Sure, I consent to you.
Thank you for your consent. I wish you a speedy recovery.